how do we support our kids' mental health from that microbiome centric lens, which is really key. Just some disclosures. I own Healthy Kids, Happy Kids, which I created almost 10 years ago now as an online resource for pediatric practitioners and for parents. I have a pediatric integrative practitioner membership that some of you on the call are in to really help bring more evidence based information to practitioners to feel comfortable seeing kids. And I'm Chief Medical Officer of Tiny Health, which we are going to dive into. All right. The two things I'm the most proud of are these two guys right here. I'm the mom of two thriving kids. They are now teenagers officially, 13 and 15. And they teach me every day. And we definitely try to practice what we preach. And they are my biggest teachers in what is doable, feasible, and also how to counter some of the pushback that inevitably comes. I am in the San Francisco Bay Area, just on the peninsula south of San Francisco, and I have a pediatric practice here. I started my practice back in 2004 as an integrative pediatric and functional medicine practice. So I've been doing this for a really long time, and I'm just excited to share my pearls and some of the lessons I've learned so that you guys don't have to reinvent the wheel and try so hard. This is my book that was just published last year. It's meant for practitioners and for parents. Really honored to have it be required reading in some nurse practitioner programs now. I've had UCLA and UCSD have me come and speak to their residents and nurse practitioners, which is really where we need to start. We need to start really at any time for educating our practitioners. Because as you all well know, we have an epidemic of childhood neuropsychiatric disorders. We know that childhood mental health disorders were on the rise even before the pandemic. Now, this is pre pandemic. 1 in 4 teenagers was diagnosed with an anxiety disorder. 1 in 15 has a severe anxiety disorder. Depression, 1 in 10 to 15 kids has depression. And by the time kids are 18, okay, by the time that we are, as their parents, hoping that they are ready to launch into adulthood, by 18, almost 1 in 2 kids is diagnosed with any mental health disorder. And the pandemic has only created a worse mental health emergency in kids and adults. Before the pandemic, this is from 2016. Okay, before the pandemic, we can see that for our youth, 10 to 24 years of age, suicide was the second leading cause of death, only after unintentional injury. And unintentional injuries often go hand in hand with mental health concerns and risk taking behaviors. And in fact, when you look at some of our public health priorities, influenza, we can see that our teenagers are 27 times more likely to die by suicide than of influenza. So we need to really think, where are our public health priorities? Where do we need to really target education to our pediatric practitioners on what crises are really facing our kids and teens? Now, it's not just teenagers and our youth, our tweens and teens. We know that even in 2019, again, this is before the pandemic, suicide was the 8th leading cause of death for our 5 to 11-year-olds. And in fact, I remember listening to one of the CDC vaccine reports. And as they were rolling out the vaccine for 5 to 11-year-olds, there was a big slide that the presenter was saying that if this had been 2019, so just the year before the pandemic, COVID would have been the 10th leading cause of death, setting the alarm bell that we need to take COVID seriously. And of course we have to. But then I thought, let me look at what the other causes of death were for our 5 to 11-year-olds. And I was floored to see that suicide was even higher, our 8th leading cause of death. And our girls are especially at risk. I'm not saying that our boys don't have mental health concerns, but when we think about our adolescent girls, 1 in 3 teenage girls has seriously thought of suicide. 1 in 4 teenage girls has made a plan, and over 1 in 10 has actually tried. Now, too many are dying by suicide. And in fact, even in the Bay Area here, it seems not an uncommon occurrence that there is a death by suicide in one of our high schools. We actually had a middle school where there was one death too. And it's not just anxiety and depression. We know that brain disorders, neuropsychiatric concerns are on the rise across the board in children. Now, this is older data for ADHD. And between 2016 and 2019, 13% of all of our teenagers were diagnosed with ADHD. 1 in 10 of our younger kids was diagnosed with ADHD. Now, 2% of kids ages 3 to 5 with ADHD. I don't even know how you can diagnose a 3 to 5-year-old with ADHD, but there you have it, right? Our kids are being diagnosed at younger and younger ages. And ADHD tends to not be alone. If you are a developmental pediatrician, if you are a parent, if you are a family practice doc, a pediatric nurse practitioner, if you see children with ADHD, you know that many times they have comorbid neuropsychiatric concerns. The majority, 6 in 10 kids with ADHD, have at least one other mental, emotional, or behavioral disorder. And oftentimes they have more than one. 1 in 2, at least half will have a behavior or conduct problem. At least half will have anxiety or depression. And the acronyms go on and on. I had a child who came in, and it would have been comical, except it wasn't. That he came in, he was 10 years old. He had already been in and out of multiple hospitals for psychiatric hospitalizations and was on 3 different psychiatric medications. And he was diagnosed with ADHD and OCD and ODD and depression. We have to figure out what is going on, because if you have a child on multiple psychiatric medications at 10 years of age, where is the end in sight? And we know that medication failures are very common. In fact, for antidepressant medications and SSRI medications, 1 in 2 people are going to have treatment failures and are not going to respond. And of course, in our children, SSRI medications have a big black box warning that we need to take seriously. There is a significantly increased risk of suicide attempts and suicidal ideation after starting SSRI medication. And that we want to also understand and recognize from a functional medicine standpoint, since you guys are here, the nutrient depletions that go along with SSRIs, the folate depletion, if they have methylation concerns, the microbiome disruption. In fact, SSRIs can disrupt the gut microbiome as much as antibiotics. Now, autism has been on the rise, and it's really not just a matter of better diagnoses. There is something going on. And while we want to celebrate neurodiversity, we also want to recognize that there are children on the autism spectrum who are not comfortable in their bodies or their brains. They are not verbal. They have significant and real inflammatory burdens and inflammatory bowel disease, for instance. So now the most recent data is that 1 in 36 children has autism spectrum disorder. That number was 1 in 44 in 2018. While anxiety in adolescence is more common in girls, we know that autism is 4 times more common in boys than in girls. Now, different locations have different rates of autism. Here in California, where I live, 1 in 22 are diagnosed with autism. The 2 states that I've spent the most time in, New Jersey, where I grew up, and California, where I've spent my adult life, have the highest rates of autism per capita. And PANS and PANDAS, how many of you guys treat PANS or PANDAS or have seen a child with PANS or PANDAS? If you have not yet, you will likely. And if we understand the foundations of PANS and PANDAS, how to recognize sometimes the very subtle signs that there may be PANS and PANDAS, because I will say, not very few, but it is not the norm necessarily to have this sudden flip, like the switch went off and now you have a different child, a different brain, right? With severe overnight OCD, tics, inability to function, decline in cognitive capacity, rages. Those kids don't get missed. Those kids are not the ones who their diagnosis may be missed if people are not familiar with PANS or PANDAS, but they are immediately getting help. But what about the kids who have a more subtle onset of separation anxiety that doesn't end, or anxiety that you think is, oh, it's because parents are getting divorced, or oh, it's because we changed schools and it's just getting worse and worse, and it's not a phase that goes away? As many as 1 in 4 kids with OCD and tic disorders like Tourette's may have PANS or PANDAS. So we need to take a look. At least, now this number is old, at least 1 in 200 US children has PANS or PANDAS. If we look, we will find that more do. And we will also find in family history, many parents will have a family history, one of the parents, or maybe both, where they say, I remember a time, I just remember vividly this one mom, she remembers a time in her childhood where she just had all of these rituals and she could barely function, but she was holding it together and she had to do all of these things. and she hid it from her parents. And it was like that for years. But she did well in school and she had friends. So nobody said anything about what was going on with her. And she says suddenly it just went away. But there are subclinical cases of PANS or PANIS that we don't want to miss. Post COVID, pediatric neuropsychiatric problems we know can be present. COVID can trigger PANS or PANDAS. So being aware of that. There are, and also, of course, multisystem inflammatory syndrome in children, MISC, can include neuropsychiatric complications. I don't know if some of you had followed any of my work during the pandemic, but what really propelled me into trying to bring so much education and information and empowerment to parents and practitioners around pediatric COVID through the pandemic was because we weren't one of the first cases of COVID, but certainly it felt like it because before lockdown in March of 2020, my children developed some very unusual flu-like symptoms, and my son went on to subsequently develop multi-system involvement, including neuropsychiatric symptoms that I was flipping out. Is he developing PANS? What's going on? He was hospitalized. Luckily, through a functional medicine approach and doing all this research, I immediately didn't know what was going on, but I started him on SPMs and melatonin and glutathione and CoQ10. Yes, in the hospital, I had my suitcase and we were in quarantine, so nobody ever checked in on us too much. But COVID can trigger PANS. There are anti-neuronal antibodies. If you guys have ever used the Cunningham panel by Molecular, where we can check some autoimmune antibodies brain antibodies found in PANS pandas kids. So those are also found in COVID-19 and children with neuropsychiatric symptoms. All right, so what's going on? We have to understand for our children the intimate connection between their developing gut and their brain. Your child's gut microbiome develops in parallel, and I say your child meaning your patient or even your own children, right? Their brain develops in parallel with their gut microbiota. And in fact, it is more that their gut microbiome is influencing their brain development than vice versa. Remember that two-way information highway, the vagus nerve between the gut and the brain, 80 to 90% of that communication occurs from the gut to the brain. Now we can see here, this is diagram of their gut microbiome. In infancy and childhood, we do not want a lot of variety. They should have an infant-like microbiome pattern. And as they get older, through the first 3 years of age, their microbiome takes a more adult-like pattern, okay? It does not stop there, though. The adolescent microbiome is different than the adult microbiome. The female microbiome is different than the male microbiome. There are gender differences and there are age differences. And that is why a test using shotgun metagenomics like Tiny Health is invaluable because we need the specific markers for a premenopausal woman versus a postmenopausal woman. We cannot look at your child's microbiome and base it on adult metrics. We can't look at your female or your male teenagers' microbiomes and also then just have a standardized adult metric that doesn't divide between male and female. It is very interesting how the gut microbiome changes. There's a divergence that occurs once puberty starts and the influence of estrogen and testosterone on the developing gut microbiome, and also vice versa. The influence of the gut microbiome on the impact of our sex hormones on our children's pubertal progression. These first 3 years of life of microbiome changes are also key for neurodevelopmental changes, right? If you have your own kids or grandkids, or you take care of kids, you know that every time you see this child, there's something different. Their brain is like spinning, and they're literally becoming a different child in front of you. They're learning different things, right? This rapid window of development. Now, any disruption to the gut microbiome in those first few years of life that are occurring in parallel with this explosion of synaptic connections in their brain can have adverse and lifelong consequences on their behavior and mental health. Now, there's one study and I can't remember whether this is Denmark or Finland. I feel like I should have this because I cite this study so often, but it was around 1 million births, so mother-child pairs, and followed these children. And what they were looking at was antibiotic exposure. Now, antibiotic exposure to that child at any age significantly increased the risk by up to 50% of pretty much any mental health concern by the time they were older kids or adults, including ADHD, sleep problems, behavioral concerns. That risk was highest when that antibiotic exposure occurred within the first 6 months of life. Now, that included prenatal antibiotic exposure to the mom because the infant is also exposed to those antibiotics in utero. Now, as a practitioner working with moms and working with children, I don't necessarily spout out the studies. I may, right? Because parents want to know how their children got to the place where they are today. But I let parents know we have this information to guide us and to really tell your child's story. We cannot go back in time and change the fact that your child received antibiotics when they were 4 weeks of age or eight months of age or whenever it is. But now we know if they have a brain or neuropsychiatric problem and their poops look perfect, I'm still going to look at their gut microbiome. This is why. And I always tell parents and kids, it is never too late to restore a disrupted gut microbiome to a healthier pattern. This is really important. This is why you being here today, I'm so appreciative. We need to get that message out no matter where our kids are starting from. It might take a little longer if there's a lot of disruption, but it's always possible. And we have to know to look in their microbiomes. Of course, many of you guys know the gut microbiome neurotransmitter connection that many of our beneficial probiotic species produce neurotransmitters. And these are really and truly gut chemicals that are acting on the brain. So when we think of neurotransmitters, we often think, oh, those are brain chemicals. The vast majority of serotonin, up to 90%, is made by our gut microbiota. At least 50% of our dopamine is made by our gut microbiota. Lactobacillus and bifidobacteria species, E. coli will produce the beneficial E. coli will produce some of our species. Even some beneficial strep and enterococcus can produce serotonin. Bacillus species, these are spore-based probiotics, can produce norepinephrine and dopamine. Now, GABA, we know that there are beneficial bifidobacteria species that produce GABA. And now, through tiny health testing, we can actually measure GABA production capacity and also GABA breakdown capacity in your child and an adult microbiome. Very important. Our gut microbiome produces 400 times the melatonin than our brain, right? And so we have this capacity in our gut microbiome, but we only have it if we have the right microbiota to produce these neurotransmitters for us. That is key. Oh, this is the study that I was talking about. I don't have my what is that presenter view on, so I didn't see. This is the study I was talking about with the exposure to antibiotics in the first 2 years of life. But the strongest risk was for antibiotics before 6 months of age, and it is a Finnish study. So you have the reference here. All right, it is not just antibiotics. I mentioned SSRIs can disrupt the microbiome. We have so many modern microbiome mischief makers, is what I call them. And I talk to kids and teenagers and parents about this. There are many other medications that disrupt the gut microbiome as much as antibiotics. I mentioned SSRIs, but also NSAID medications, reflux or antacid medications, antihistamines. Yes, antihistamines like Zyrtec and Claritin, steroids and oral contraceptives. When I think about our teenage girls and what's happening to them, how many of them are on antibiotics for their acne and on birth control pills for their horrible period cramps and also on SSRIs because they have anxiety? And maybe they help initially, but then as their microbiomes become further and further disrupted and we're not supporting their microbiomes appropriately, notice I didn't say get them off their medications right away because maybe they need those medications or maybe they're not yet ready to go off of them. However, but we need to support their microbiomes appropriately, even when they're on antibiotics, to give them the best chance to have the healthiest brains possible. Environmental toxicants like our parabens, phthalates, our forever chemicals, many of these are known as endocrine disrupting chemicals, but they are all also microbiome disrupting chemicals. And in fact, there's one article that notes that this could be maybe the main mechanism behind why these endocrine disrupting chemicals don't just disrupt our hormones, they disrupt almost everything in our system, including brain, including mental health. Glyphosate, which is Roundup, which is initially patented as an antibiotic. Ultra processed foods, too much added sugar, the artificial sweeteners like sucralose and aspartame potassium, aspartame, saccharin have also been found to disrupt the gut microbiome. Our FDA approved food additives, there are over 3,000 food additives in the FDA's database called Everything Added to Foods in the United States. I mean, it's literally called something like that. But emulsifiers like mono and diglycerides and xanthan gum and carrageenan have been found to have direct disruptive effects on the microbiome, including triggering leaky gut and gut dysbiosis. EMFs may trigger gut dysbiosis, psychological stress, lifestyle stress, lack of exercise, lack of sleep, lack of hydration. Now, I will note the psychological stress is this becomes this vicious cycle where psychological stress can trigger zonulin release. Zonulin is a marker of, it's a protein that's released from leaky linings, not just gut, also spleen and brain and our immune cells. So it's not just a gut marker, but it can be a marker of leaky gut. So psychological stress can trigger zonulin release within 1 hour. Okay. So we have all of these factors. Now, and many of our kids and teens are exposed to all of these. So we can't have them live in a bubble, in a lonely bubble, nor do we want them to, because we know through the pandemic how much loneliness was really noted to be a risk factor for serious health outcomes. So what we need to really think about is how do we support microbiome resilience in the face of all of these microbiome mischief makers? All right. So what happens when the gut microbiome is disrupted, especially for pediatric mental health? We know there can be gut dysbiosis, which can be either not enough beneficial microbes, too many pathogenic microbes, or a combination of both. Of course, leaky gut can then ensue and metabolic endotoxemia. Okay. There are many studies looking at gut dysbiosis and mental health disorders. Okay. This is just the tip of the iceberg. If you do a Google search or if you use AI and use consensus or perplexity, you're going to come up with so many articles showing that gut dysbiosis is linked with many mental health disorders. When the gut microbiome becomes disrupted, we can also have leaky gut, which as leaky gut means these tight junctions between this healthy small intestinal lining becomes more leaky. And then once these, and you can have zonulin, claudin, occludin, these are proteins that can become released. What we then have are these toxins, medications, larger food antigens that slip through and create immune reactions. Okay. The other thing that we notice is that our small intestinal villi become not nice and upright. They start to atrophy. In fact, celiac disease is complete villus atrophy where these villi are flattened. Okay. But what we then have, these villi are responsible for absorbing our nutrients. So then we get this state of increasing toxic burden, inflammatory burden, and decreasing nutrient absorption. So we can become increasingly malnourished. Okay. Leaky gut has been associated with children's health problems since at least, now this study is from 2005. That's 20 years ago, and it's still not being talked about enough and certainly not being discussed in conventional medical training for pediatricians or any physicians. But leaky gut has been linked with autism, atopic disease, type 1 diabetes, inflammatory bowel disease, sepsis. And we've known about leaky gut. I remember looking at this for my book in the first study of leaky gut, linking eczema to leaky gut was, I believe, in 1983, over 40 years ago, right? This needs to become more mainstream. We see leaky gut and pediatric neuropsychiatric conditions in the literature. Higher serum zonulin and occludin were found in kids with ADHD. The higher the zonulin, meaning the more leakiness that there was, the more the hyperactivity and social impairment. Now, remember I said zonulin is a marker of leaky gut, but also we have tight junctions found in our brains, heart, lung, liver, kidney, skin, immune cells, and even our fat tissue. Higher serum zonulin levels are also found in autism. And again, the higher the zonulin, the worse the autism rating scale. And also found in children with OCD. Okay. Now in OCD, they found claudin 5 was elevated, but not zonulin, but still leakiness there. MISC, multisystem inflammatory syndrome in children. Dr. Alessio Fasano, who is brilliant. He is the pediatric gastroenterologist in Boston, Harvard, who really brought awareness of celiac and non-celiac gluten sensitivity to the world. He's fantastic. And so he found higher levels of zonulin in children with MISC. So in children who were hospitalized in the ICU or the pediatric ICU with multisystem inflammatory syndrome in children, he gave these children lorazepam, which you can actually get compounded. but it's an experimental medicine for leaky gut, and found that those children had significantly more rapid and time to recovery and improved clinical outcomes. And then if we have gut dysbiosis, especially a particular kind of bacteria, gram-negative bacteria in the Enterobacteriaceae family, which produce endotoxins, we can have metabolic endotoxemia. Okay. Now, these gram-negative bacteria, including E. coli, Salmonella, Shigella, Klebsiella, Citrobacter, Proteus, Serratia, if you know these microorganisms, you know that these pathogenic bacteria actually also can trigger and are associated with autoimmunity. Okay. But on their cell walls, membranes, they have lipopolysaccharide, LPS. Okay. When this LPS is released from these bacteria and they circulate, if there is a leaky gut, that LPS can slip through the leaky gut lining into your child or adult patient's bloodstream and cause metabolic endotoxemia. That is what that means. That LPS then circulates, okay, binds with LPS binding protein, and then lands somewhere. Wherever they land, they create inflammation, right? They activate NF kappa beta and inflammatory cytokines. And if they land in the brain, they can trigger psychiatric symptoms like we know endotoxemia is associated with depression, anxiety, schizophrenia. If they end up in the joints, maybe there's going to be some autoimmune joint problems or in the gut. Okay, so metabolic endotoxemia is a very significant problem for, I would say, not just mental health concerns, but any chronic disease. If you are not already familiar with metabolic endotoxemia and treating endotoxins, it is a must because it can be a game changer for some of our patients. Gram-positive bacteria can also produce exotoxins that are similar to endotoxins. So these organisms like Streptococcus, Listeria, even Candida can produce endotoxin-like compounds. Okay. Now I highlight Klebsiella and Citrobacter because these are very common Enterobacteriaceae that I see when I do microbiome testing in kids with mental health concerns, autoimmune concerns, PANS, PANS. And that is something that I absolutely want to treat. In fact, one of my kiddos who had Crohn's disease and juvenile rheumatoid arthritis, the thing that finally pushed her over the edge into remission was treating her Klebsiella. We can see metabolic endotoxemia in children with PANS and PANDAS, in children with autism and ADHD, and in children with mental health disorders. Okay. So how do we know if the gut microbiome is disrupted? We can presume if you have a child with neuropsychiatric symptoms, I would bet some disruption, right? But we want to test, not guess. You guys have all heard that saying. But with the microbiome, it's true because the trillions of microorganisms in your gut and the many different ways that disruption can occur, we want to target our treatments and not just dump a whole load of supplements onto our patients. All right, so the role of microbiome testing. Now, Tiny Health testing uses shotgun metagenomics testing, which gives us so much more opportunity to dive into the microbiome and understand the nuances and the subtle disruptions that have occurred that we need to address. Okay. And unlike PCR testing, which amplifies certain microorganisms to see if they're there, we don't know relative to the rest of our microbiota how significant is it? How much is there? And is that level going to be pathogenic? So, looking at shotgun metagenomics, we can look at the genomics of all of the gazillion kinds of microorganisms that we have their genomes for and identify what's in your child's or adults microbiome, what microbiota are there, and what are the relative abundances. Okay, because we want to know, is there gut dysbiosis? Are there too many dysbiotic microorganisms? Are there too few beneficial microorganisms, or are there both? Is there a leaky gut? Now, zonulin, fecal zonulin is actually, I know there are some tests that use that, but it's not necessarily the most reliable indicator of leaky gut. The studies that I mentioned with zonulin and children's mental health concerns use serum zonulin, not fecal zonulin. And fecal zonulin can vary, and we know may not necessarily be reflective of the actual leakiness that's going on. What may be better are mucus degradation index, a high degradation index. Remember, we need Akkermansia muciniphila, makes mucus for us, right? We have our gut microbiome and our villi are covered with a mucus layer that protects our microbiome and our gut lining. High hydrogen sulfide index is inflammatory. High host DNA. Why is that? If your small intestinal lining is leaky and you have a lot of our intestinal lining sloughing off, then we can see human DNA in our poop, which we really shouldn't, right? How do you test for metabolic endotoxemia? You can see a high hexa LPS index. Remember, lipopolysaccharide? That's what's on the outer membrane of gram-negative bacteria. Other useful markers for pediatric and adult mental health: GABA production capacity and breakdown. This is one of our newer markers in Tiny Health, and it is so fantastic. It's so helpful because I don't necessarily want to put every kid on GABA. Maybe that would help everybody, but if we're going to be more targeted and there's low GABA production capacity or high GABA breakdown, then supporting GABA may be a significant benefit for their mental health. We can look at high histamine producing species. Many of you guys know that our gut microbiota produce many of our vitamins, including many of our B vitamins, B2, B9, which is folate, B12, B6, also vitamin K. So we can look at B vitamin production capacity and vitamin K production capacity. Of course, we know from the testing that we've had to date, and we can look at digestion and absorption markers. We can look at traditional inflammatory markers. We can also look at metabolic markers like short chain fatty acids. But what's amazing with shotgun metagenomics is we can look at the genomes of our microbiota and see what is the production capacity of our microbiome to produce these beneficial short chain fatty acids like butyrate, acetate, propionate that have tremendous benefit for our brains and our immune systems and our hormones and our metabolism and really all the things that we need to function well as human beings. Tiny Health's shotgun metagenomics is really the gold standard for microbiome testing, looking at your entire microbiome and not just this narrow subset of PCR where we amplify certain genetic sequences to find specific microbes. And when it comes to pediatric microbiomes, remember I said in the beginning, children's gut microbiomes are not little adult microbiomes. Children deserve their own microbiome analyses, right? We want to make sure that we honor their little microbiomes as they're developing in a very different way than their teenage microbiomes and their adult microbiomes. We need age-specific microbiome analyses, okay? So just as an example, I apologize that this is blurry, but we can see here, Tiny Health is the only company that has age-appropriate reference ranges for all ages. Now, some people mistakenly think that Tiny Health is just for kids. It is not. Tiny Health is really tinier, tiny microscopic organisms, our friends in our tummies, right? This tiny ecosystem inside of us. But the reference ranges are appropriate for adults of all ages and for infants and children and teenagers, which is why now it's the only test that I use for kids and for adults. Okay. So, for instance, a 3-month-old baby should have 80 to 100% bifidobacteria species. When it comes to the infant microbiome, diversity is not your friend. Okay, bifidobacteria is fed by our human milk oligosaccharides, prebiotics found in human breast milk. That is why evolutionarily, human breast milk is chock full of these prebiotics that only feed bifidobacteria. Okay. As kids get older, start to eat solids, by the time they're 3, they take on a more adult-like pattern. By 3, bifidobacteria should make up maybe 10 to 15% of your microbiome. By the time you're an adult, that number gets lower. And this range you're going to see as you do your Tiny Health testing, it does change, okay, even in adulthood. Now look at this Enterobacteriaceae. Remember I said Enterobacteriaceae, E. coli, Klebsiella, Citrobacter? I don't want to see any of that, right? As an adult or a teenager, this should be 0. 0 of that. But what we note is in children, okay, in infants, Enterobacteriaceae appropriately can make up to 0.1% of your microbiome. As they get a little older, maybe 0.5% of their microbiome. And then as they become more adult-like, they should have 0. Why is that? Because we need some exposure to their microbiome to train their microbiome. Remember, we don't want to grow up in a sterile world, okay? But we would never get these nuances if we just looked at a standard PCR analysis with adult ranges. All right. So Tiny Health really is the new standard for kids and for adults. It's a super easy swab. Literally, you don't need the French fry container unless there is a pro test that has more markers that can be helpful. But if you're doing the baseline gut health test, which gives you so many valuable markers, it's just a swab, right? Your parents are changing their kids' diapers, literally just touch it into the diaper, right? So how do we repair the gut-brain connection? In my book, I talk about the gut reset that I use with kids, okay? And this is the wheel of whole gut resilience. When we're talking about resetting the gut, This RE stands for returning to the five things for microbiome magic. These are all the ways that we can nourish our gut microbiome with getting the right foods in. I call them our microbiome champions: fiber, the three F's: fiber, phytonutrients, fermented foods. And yes, I know phytonutrients are a pH, but they sound like an F, make it memorable. Keeping out our microbiome mischief makers in our foods: glyphosate, ultra processed foods, emulsifiers, too much added sugar. We need to engage our vagus nerve to restore our microbiome to health. We need to move and hydrate and sleep. All of these have microbiome benefits. And without these foundations, you can restore your child's gut microbiome with supplements, but you probably won't keep them there. This is the foundation. And I have the entire part 2 of my book is on this. Okay. And it's so fun to teach kids how to do this. Seal and heal the leaky gut, eliminate the dysbiotic organisms, and transform the gut microbiome. So, this is just in a nutshell. Again, there's more outlined in my book, and there will be more in the boot camp, much more in the boot camp that is coming up. So, healing the gut, you're going to give your gut a break from anything inflammatory, including inflammatory foods, repairing the gut lining with gut repair nutrients, eliminating gut dysbiotic organisms, feeding the good guys first. Always, we want to nourish our good guys before we start the killing. Everyone wants to start with the killing first. That is the last thing we should be doing, because in fact, upping your probiotic levels, getting the good guys in, will start to crowd out those dysbiotic organisms, so you have less killing to do and it's easier on your patients. So LPS, lipopolysaccharide, can be bound by serum-derived bovine immunoglobulin. SBI is one of my favorite supplements ever. And then targeting the gut microbiome with strain specific, if you can. Probiotics, prebiotics are essential. Postbiotics, fermented foods are a great way to do that. And I use a lot of vagus nerve supports in my practice. Okay. Now, we need targeted gut microbiome analysis, recovery guided by age appropriate microbiome analysis. I'm going to give you an example of a 10-year-old girl who came in. PTSD, ADHD, ODD, dyslexia, anxiety, depression. Literally, she was diagnosed with, what is this? 1, 2, 3, 4, 5, 6 psychiatric disorders. She has tried Prozac and Ritalin and Strattera and just became more and more rageful and depressed. Meds have made her worse. She was miserable. Her family was miserable. She hardly ate anything. Her appetite was terrible. And so when she came in, we did some microbiome analysis. I did more than that. I did blood work. I looked at some PANS markers, which she didn't have. I looked at organic acid testing, and absolutely I did a microbiome test. Okay. And what we can see, she's in the lowest 20th percentile for her microbiome score. This is a summary at a glance that you'll see with your test analysis. We can see here on her beneficial bacteria, she had bifido that was actually okay, but she did not have enough Akkermansia or Faecalibacterium. Akkermansia mucinophila, we need for a mucus layer in our gut lining. Faecalibacterium is one of our primary butyrate producers. Okay. And the plan here, really focus on a microbiome nourishing diet and lifestyle. I spoke with her at 10. She was ready to take ownership. She actually was interested and willing to try certain foods. Her mom was floored, but once we give kids ownership and empower them, they can start to make these decisions for themselves, even if they're young. She had all of these enterobacteria. So I was really concerned, does she have LPS induced metabolic endotoxemia? And sure enough, her hexa LPS was high, not as high as I suspected, but it was high. Mucus degradation. She doesn't have Akkermansia to support her mucus layer. So she has these dysbiotic organisms that are basically chomping away at the mucus layer, and hydrogen sulfide is inflammatory. So started her on gut repair nutrients for her leaky gut and serum derived bovine immunoglobulin, SBI, for the metabolic endotoxemia. Okay. And she had very low, look here, this GABA production, non-existent GABA production. Okay. So also started her on GABA supplementation. And thankfully, no evidence of inflammatory bowel disease. She actually didn't have any, quote, gut symptoms, even though now, the brain symptoms are gut symptoms, right? But no evidence of IBD. And so started her on that supplement regimen, slowly tried to work into returning to the 5 things for microbiome magic, gave her some handouts from my book to get them started. And first follow-up, it's only been a couple of weeks, but the parents, the child, they're finally feeling hopeful, slowly improving. She's not as rageful. She can monitor herself a little bit more, and she actually started smiling more. That was what was heartbreaking to mom. She just stopped smiling. She just had no joy. And so we're going to keep pushing and get more. I'm really hopeful. When I saw what was going on in her microbiome, there were so many things that clicked for what was going on with her. So now we have some actionable items for her. Whereas before, there was just nothing but throwing the dart at the dartboard, trying the next psychiatric medication.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.